Hey everyone. So today we are living well, the ultimate health journey. And today Dr. Phillips is going to be talking about gut health and the properties of what we should be doing on a day-to-day basis and how to actually achieve a healthier gut. So Dr. Phillip, take it away.
Thank you. So I'm going to start off really kind of racy and maybe a little bit raunchy, and that is the old adage is how do you get to a man's heart, right? It's through his stomach and what you're supposed to feed him and all that stuff. Well, as it actually turns out, not only does your gut control the heart health, but also brain health. So we always thought about there is some type of connection, but we're realizing that there is not only like a satiety connection or feeling full or hungry or something like that, but there's actually a hormonal connection. So what happens in the gut can affect your hormones. Those are hormones for metabolism. Those are hormones to help drive good gut health. And as a result, anything that we can do to help make the gut healthier, that's going to be beneficial. So, a little bit of anatomy lesson. Some people think of the gut as a thing that's kind of around your belly button, but really the gut starts at your mouth and then ends at the other end. And you all get the gist of where that is. And in between are a variety of properties where enzymes are produced to help break down foods, things are produced to help absorb foods. There are ways to absorb the foods better. There are ways to absorb water and to conserve water. And it all happens in that very long tract, which we call the intestinal tract, or some people call it the GI or gastrointestinal tract. So, starting at the mouth, the best thing you want to do is have good dental hygiene. So, had a lovely conversation with my dentist at a seminar, and we both agreed that really overall health starts in the mouth with reducing inflammation there. So that means regular brushing. That means making sure you get plenty of water. You're seeing your dentist for regular cleanings. And then you're using things that can help out with reducing inflammation and antioxidants and free radicals and promoting that, um, reducing oxidative stress. And we'll talk a little bit about that more. Then moving down the line, you get the esophagus. That's a big food tube from the back of your mouth that goes down into your stomach. And what that does is it helps to kind of push things down. So that's why making sure that you chew your food a lot. The whole adage is like 30 seconds or something crazy. No one ever does that. But anyway, the more you chew it, the smaller it is, the easier it is for things to digest when it gets down into your stomach. And the stomach is kind of like the big some people call it masticator, kind of like the grinder, if you will. It will kind of break down foods and it'll help get foods into smaller molecules. So that means peptides, which are a connection of amino acids, or fatty acids, which are a connection of different types of fat molecules, and then the what are called micronutrients, and that means the vitamins and the minerals, and help break those things down. So once they're broken down, they have to be absorbed, and the best way that they're absorbed is when the lining of the intestinal tract, that means where things kind of go across, because that's really a barrier between a healthy body and an unhealthy body. Because if that barrier is broken down, then things are leaking through, and that leaking through can cause inflammation. You may have heard of something called leaky gut syndrome, and it literally is just that. Things are leaking through that are getting through that aren't supposed to get through, because even though it could be healthy, like a peptide, a group of amino acids, the body doesn't normally see that. And as a result, it looks at it as something that's invading the body. And then you'll develop an immune response to it. And with that immune response, now you're developed a hyper immune state or an overactive immune state or this kind of over on guard, and your body's kind of constantly freaking out over all these invasion type of things. So the best way to do that is by making sure that you're getting the good natural bacteria in your system. And those are things like prebiotics and probiotics, and also the natural vitamins and minerals that help out with the lining. And then, as we mentioned before, in the mouth, reducing inflammation, and then also reducing oxidative stress. So that's kind of the big point, and we'll stop there for a second and see if there's any questions that people may have leading up to the what's called the small intestinal tract.
Yeah, so we have a question. How often should you cleanse your intestines with enemas?
So good question. Most people, and we had a detox seminar last week. Most people advocate to do some type of detoxing at least once a year. And that detox could be as easy as a 24-hour water fast, or it could be a little bit more complex with doing a 24-hour to maybe 5-day liquid fast. And then the next step would be doing some type of hydrocolon cleansing. And the reason why I want to differentiate between an enema and the hydrocolon cleansing is an enema doesn't necessarily clean you and detox. The enema is going to make you go to the bathroom, which is good if you're constipated, but it doesn't really help to cleanse you. What you want to do is literally hydro cleanse the colon, and that means inserting a small tube into the rectum, and then gently filling the rectum with water and allowing, and it's a balanced water, balanced by pH, which means it's not too alkaline, it's not too acidic. It's balanced as far as the the normal type of salts that should be in your body. So this way, it's not going to cause a shift from liquids going out of cells into the colon or vice versa. And it's that type of controlled cleanse that should be done. And that could be done at least once a year. Some people will do it twice a year, depending on what their issue is. If we're trying to do a detoxing cleanse for someone that may have cancer or someone that has some type of a viral or bacterial infection, we may end up doing it a couple of times a week for maybe 2 or 3 months. Then the next question is, where does the prebiotic come from? Actually, you can do good prebiotics with just food sources, and probably the best kind of prebiotics, and also some probiotics, are fermented foods. The most common is kombucha. Most people have heard of kombucha. It's a fermented juice. We get a big bottle of it at a big box store. I won't tell you the name, but you can kind of figure it out. And we'll have a small glass of that every morning on an empty stomach, just to kind of load and go for the day. Are there any lifestyle changes or habits that can help improve gut health on a daily basis? Absolutely. The biggest thing is to try to reduce the amount of processed foods you have. That's the easiest thing. I remember a nutritionist taught me this years ago, and she said that if you shop on the outside or the periphery of a grocery store, you're probably be doing pretty good, right? Because on the outside, that's where all the fruits and the vegetables and the whole protein things are. So fish and chicken and things like that. So if you concentrate on trying to consume those, you're going to be better off. Stay away from the bakery with all the sweets and the cookies and that stuff. That's also on the outside, but stick more with the fruits and the vegetables and the whole foods, which naturally have fiber, because fiber is going to help you out, and also lots of water. The more water you have, the better off you're going to be. Those are really quick, easy things that anyone can do. Is there a connection between gut health and weight management? Absolutely, because one of the bacteria in the gut is called GLP-1. You may have heard of that because there is a boatload of pharmaceuticals out there called GLP-1 um, drugs, and it's these big class of drugs that mimic this natural hormone that's produced in the gut by this bacteria. So the reason why the pharmaceutical industry jumped on it is because this natural hormone that's produced by this bacteria helps with increasing satiety or making you feel full, and also naturally helping to suppress your appetite. And it's a heck of a lot cheaper. You can get this for anywhere from, I think it's like 70 or so dollars a month. There's a little bit fancier ones that may be 150 a month. But when you look at that compared to some of these co-pays for these injectable GLP-1 mimickers can be as much as a couple hundred to $1,000 a month out of pocket. And all the research shows, and this is what we talked about last week, all the research shows that when you stop that, a majority of people are going to gain the weight back because you haven't changed anything in your gut or your gut health. So, yeah, good question. There are some natural things you can do, and it is a big key to weight management.
So as we're talking about taking in meat, I want you to clarify something for me. So I heard that when you leave this earth, that there is a good amount of how do I say this? There's a good amount of meat still in your colon, in your intestines, like undigested. Is that true?
So yes and no. And what I mean by that is because it's a lot harder for your body to break down animal proteins, it's going to linger in your colon longer. So hence, for people that have a high animal protein diet, yeah, they may have to do a hydrocolonic cleansing more frequently, especially if they don't have a lot of good fiber to go along with that. So um, if you can, and the old adage is the serving of an animal protein should be, you're all from the Midwest. I grew up in the Midwest. It's the size of your palm or a hockey puck. Most people in the Midwest know what a hockey puck looks like. That's about the size of it. But when you go to a restaurant, it's constantly supersizing me, and it's $24 for a 6-ounce filet, but for just $40, you can get a 16-ounce. So, of course, you're going to spend a little bit of extra money, get the big honking piece of meat. You don't need that much. You need a palm of the hand. That's it. So, yeah, there is some truth to it that stuff does linger, but that's the reason why we always are advocating fiber, fiber, more fiber, water, water, more water, so things can have less of a chance to kind of linger in your colon. Frank asks, what are the most common signs of a gut bacteria imbalance? Usually it's something to do with your regularity. So, and it's kind of crazy. It's not one or the other. So it's not constipation or infrequent bowel movements. In other words, most people have a bowel movement at least once a day. So if your bowel movements are less frequent, then that's usually a sign that there's not a good balance. If you're having loose stools, that's also a sign that you're not having a good balance. And then the body kind of freaks out. So it gets kind of backed up and it says, hey, this isn't good. And then it pumps a bunch of water into the system and then flushes everything out. So then you get a loose stool and you're thinking, what's up with this? I was kind of not regular and now all of a sudden I've got a loose stool. So you can bounce back and forth and be somewhere in between too. The other thing is gas, especially if it doesn't smell too good. Also, if you belch a lot or just your stomach is kind of rumbling, those are some of the telltale signs. And as Teresa said, if you're having problems with weight management, that could be it too. Marilyn, how can I prevent or manage common gut issues like bloating, gas, or acid reflux? So you've actually hit on two different things. Acid reflux is usually because there is not the right acid, and I know it sounds crazy because it's acid reflux, it's acid backing up. It's because your body isn't producing enough of a good acid, and that good acid helps to keep down bad bacteria like H. pylori. Um, 40 years ago, there was a physician, pathologist, and he said, ulcers are really because of this bacteria. He got laughed out of the medical community. Here we are now, 40 years later, and he was right all along that most of the ulcers, most of the cancer that we see in the gut is because of this over rampant abundance of H. pylori, a, a normal bacteria that usually is in the background, but then it just overgrows because of an abnormal environment. So that would be one thing I would look at. And usually by looking for abnormal bacteria, you can find out what that is. So anyway, a good rule of thumb, again, I hate to sound like a broken record, but lots and lots of fluids, try to get as much fiber in as you can. Try not to have late meals because that'll directly affect acid reflux. And that should help to calm things down. So this probably is a good segue into how do you detect this stuff. So there are fancy stool tests where you have to fish your stuff out of the toilet bowl, put it in a plastic bag, send it off to the lab, and that'll tell you exactly what's in there and then what kind of the balances are. The other is to do a blood test, and the blood test will tell you what foods you may have an intolerance to. And then the third way, and this is the way that I found that's been very helpful, and I've been using it for coming up on 2 years now. One of my colleagues has been using it for, I think, close to 6 years now. And it's called a functional test. So what it does is it looks at how your body reacts to a whole myriad of things. So not just a handful or 100 foods, but over 1,000 different foods. It looks at preservatives and additives and vitamins and minerals. And then it tells us what foods love your body back. Because believe it or not, there are some foods that you should probably avoid eating for a little while, like maybe 90 days or 6 months. And there are foods that you should really kind of load in and lean into to help heal your gut. So it's called Fresh Start, and that's a good way to kind of get a snapshot of where your gut health is. And we've had tremendous success with getting people to reduce weight just by fixing the gut. Sounds crazy, but by fixing the gut, we can really help out a lot of things. So I'll stop there because I rambled on again.
Well, that's awesome. That's great news, Dr. Philip. I know I had someone also ask, is kefir also a good component for gut health, gut health?
So again, it's a fermented product, and any type of fermented product is good. The interesting thing and the added advantage of kefir is that it's usually, I think usually, made from goat milk. And goat milk is the least allergic or the least intolerant, which means the most tolerant for people. Man, for some reason, was not meant to be brought up and drink cow milk. That was the big agricultural farmers from Wisconsin. You know, I guess it's California with the happy cows and cheese. But anyway, um, we weren't meant to really digest cow's milk. And they thought, well, you're getting breast milk, but that breast milk is from a human, not from a cow. I mean, I won't even go there with the analogy, but anyway, you get the idea. So we weren't meant to have cow milk, but for some reason, goat milk is okay. But when you think about it, it's kind of biblical, right? It's been around for 3,000 years where they've been drinking goat milk and making goat cheese. So it's just naturally more acceptable for the body. So good question. Good point. So I guess we'll end on what are some of the supplement things you can kind of do. So if you think about how the body is positioned, and there's kind of four quadrants. So there's one quadrant, which is the outside of the little individual cell. And on the outside of that cell, it's constantly being bombarded by inflammation or things that are trying to irritate the heck out of it. So the best product that has the most anti-inflammatory type of properties is from a fruit, and that fruit is called mangosteen. Mangosteen has something like 200 xanthones in it, which all help out with inflammation. And we have a great product that is in a mist. So instead of drinking gallons of juice a month, all you need is just one mist bottle, and you use that at night. So that's on the outside of the cell that's attacking the cell. So once we kind of calm down the inflammation or the flames on the outside, now we can work on the inside. On the inside, it's glutathione. Glutathione, the production of it starts trailing off at about 20, at about 40, your body can't produce enough and needs help. So for that, the best way to get glutathione is in small daily doses every day, because the half-life is so short that if you go to a clinic and spend a bunch of money and get an IV, then you're going to be doing that every day. And that's impractical and too expensive. So we have a glutathione product that it's called nano size, which means it kind of compacts it and makes it so small that can easily pass through the cell. So that's why it's in a spray bottle and it doesn't have to be in an IV. So then the next thing is looking at, so now that we've kind of got the inside of the cell boosted with the glutathione, so it can help reproducing those healthy cells. I forgot to tell you, the body produces and replicates about 3.3 million cells every second. 3.3 million cells. 3.3 million cells. Just kind of run that through your head. So now that you've got that, now you want to help with the whole foundation, and that's where our ultimate vitamin comes in. Again, we didn't have, and we don't have a claim to fame for inventing any of this stuff, but what we did invent and what we have the patented process behind is the delivery. So we take stuff that wasn't really bioavailable or wasn't easily absorbed, and now we make it really easy to absorb. So our multivitamin has 23 vitamin and minerals chelated, so that means they get in the system. It's also helps out with that old hydrophilic, lipophilic. So things that may be fat soluble, they get in. Things that are water soluble, they get in. And then the last component is the immune system. Because remember, when we talked about the immune system is under attack, especially if you have leaky gut, things are getting through that aren't meant to get there. So the immune system is kind of on high alert, red alert. So as a result, we have something called Super 7 that has all the 7 superfruits in it, so that this way it can help to modulate the immune system and kind of help the immune system to come on track. So all these things are a nice foundation. So that's why we call it Vital for Life, because it's vital to have a good foundation and a good core for your body.
I would like to point everyone's attention to the link below. You can receive all of these amazing healthy products for your wellness and well-being at wellbeingpath.myctfo.com.
Yeah, and it's a great place to start. If you're already taking some type of vitamin, this will be an easy, affordable way to replace it with something that's going to absorb and get into your body. Because remember, the most expensive thing that you're going to take is something that doesn't get absorbed and doesn't do the job. So if you're going to take something, it should be cost effective. It should be getting into your body and doing what it's supposed to do. If it's not doing it, then it's not helping you. Make sense?
Yep.
Totally makes sense.
Thank you.
So we are the Living Well, the Ultimate Health Journey with Alice Boswell, Dr. Philip Zini, Angel Conway, myself, Joe Marie. Thank you guys for coming on. Thank you, Dr. Philip. I'm truly grateful for Alice, Dr. Philip, Angel Conway. You guys are amazing, always helping people out and serving, and that's the main thing, is for us to go and serve the people that need our help. So I'm truly grateful. The overall that we're talking about was good gut health. So remember, everyone, do your good gut health, your Vital for Life. That's the main one that you want. It has all the supplements that you need, everything that your body needs, especially for your gut health as well. So look at the link below, wellbeingpath.myctfo.com. And we'll see you next Wednesday at 8 p.m. Central Time, 6 p.m. Pacific Time, and 9 p.m. Eastern Time. So you guys have a great one. Dr. Philip, do you have any?
Hi, my name is Dr. Philip Zini, and I wanted to give you a little bit of a background about the importance of glutathione. I get so many questions about it, I thought I'd put together this quick 2-minute pictorial tutorial. When you are born, you're at the highest quality point of life. So the whole idea is to maintain that high quality of your life. But what happens? You cry, you take your first breath of air, and that, amongst many others, is your body's first exposure to free radicals, which can damage your body. Then you take your first drink of water and eat food. You live in the environment. All these things produce free radicals. Even doing healthy things like exercise produces free radicals. When you sum it up, these are all the events that you naturally do by living life. So the importance of glutathione is to help soak up or neutralize these free radicals, to reduce the oxidative stress, cellular deterioration, and accelerated aging. We notice that glutathione production starts to decline about age 20. Then glutathione production rapidly declines and replacement is recommended by age 40. All this corresponds with the usual modern mainstream medicine lifespan downward spiral, which is about 80% of your expected lifespan, which coincidentally is where most people only spend about 20% of their healthcare dollars on themselves to promote a healthy life. Paradoxically and sadly, when you enter that downward end of life spiral, of about 20% of your expected lifespan, that's when you're forced to spend about 80% of your healthcare dollars just to try to forestall the inevitable grave. To live beyond that average life expectancy of 76 years of age, you should invest your healthcare dollars wisely now. You want to square the curve of functional health span medicine. So this way, you're out having the time of your life, riding your bike, and you accidentally ride off a cliff and life ends, happily doing what you love to do most. How do you do that? With Glutamist, the first glutathione mist end product. Prior to Glutamist, you would come to my clinic, get an IV infusion, which cost hundreds of dollars, sometimes in some clinics up to $1,000, and get an IV started, or an injection of glutathione. And you'd often have to repeat that. I like to be on my side of the needle, not your side, so I think you would probably want to just twist and mist. So now with Glutamist, all you have to do is twist and mist, no pain, easily affordable, and at a cost that you can use Glutamist every day. So please contact the individual that invited you to this presentation. They'll help you order yours today. I hope I've encouraged you, given you wisdom for health. May God bless you. Thank you for listening.